Hi, I am Ruth Ravichandran, and in this talk, I will be presenting SleepApp, a framework that provides contextualized and actionable sleep feedback. In the United States, an estimated 50 million people have poor sleep quality or a sleep disorder. Despite the pervasiveness of sleep issues, people struggle to assess and improve their sleep health. Sleep health in the medical community has largely been focused on the identification and treatment of sleep problems, and sleep health as a recommendation for the general population does not have well-defined measures. When generic population-level recommendations are followed and people cannot see the difference in their quality of life, it can be frustrating and discouraging. A good goal for sleep technology is to make personalized recommendations to individuals based on both subjective and objective data, provide actionable insights, and allow for self-experimentation. A new framework proposed by Boise defines sleep health along the following 6 dimensions: regularity, satisfaction, alertness, timing, efficiency, and duration. In order to facilitate self-experimentation, we identified the following. Environmental and behavioral variables that affect sleep quality are classified as independent variables. These, in turn, affect nighttime sleep quality, which is measured through regularity, satisfaction, timing, efficiency, and duration, which are classified as dependent variables. Sleep quality, in turn, manifests as changes in alertness and working memory the following day, which are classified as extended dependent variables. We designed an Android smartphone application SleepApp to serve as a user-friendly tool to collect the independent, dependent, and extended dependent variables related to sleep health. We divided the 12-hour daytime period roughly into 4 windows and collected subjective and objective data through validated tests. Before going to bed, participants would log pre-bedtime activities in addition to the EMA tests in the window. When they woke up, participants logged subjective sleep quality assessments using a sleep diary and the lead sleep evaluation questionnaire. Throughout the day, we used the psychomotor vigilance test to objectively measure daytime alertness and the NBAC test to objectively measure working memory. We conducted the study with 9 participants over a 2-week period. This figure shows the repeated measures correlation between duration and sleep quality rating. While the number of hours is correlated to subjective sleep quality rating, the range shows that not everyone needs 8 hours of sleep to feel well rested. To see the effect of actionable variables on daytime alertness, we included only the variables that participants have a direct control over, such as pre-bedtime activities that were tracked using the journal, and the timing and duration of sleep. We found consuming a large meal, electronics usage before bed, and having varying bedtimes to have a significant effect on daytime alertness. Similarly, we explored the effect of actionable variables on daytime working memory. We found alcohol consumption, sleep duration, and varying sleep times to have a significant effect on working memory. Following our study, we wanted to find out how likely people are to avoid behaviors that affect sleep quality if SleepApp provided personal recommendations. We also wanted to find out if people's likeliness to make behavior change corresponded to different levels of improvement or decrement in cognitive function. We conducted a survey to explore intent for behavior change with 57 mTurk respondents. The first portion of the survey was about sleep hygiene and their awareness about variables affecting sleep quality. The second part of the survey consisted of example scenarios of recommendations generated by SleepApp and the participants' likeliness to make behavior change based on those scenarios. While respondents were more likely to find the nightly recommendations useful, they were not as likely to follow the recommendations from SleepApp every night. On the other hand, respondents were more likely to follow the recommendations on the eve of an important event, such as an examination or a presentation. Respondents were more likely to make changes to their behavior if SleepApp predicted an improvement in cognitive function than to avoid a behavior when there was a predicted decrease in cognitive function the following day. In summary, SleepApp's models confirmed interpersonal trait variability in sleep. SleepApp provided contextualized sleep feedback using actionable variables that affect a user's daytime cognitive function. And SleepApp provided users the ability to perform self-experiments to figure out what they're willing to change to improve sleep quality. Opportunities for future work include facilitating better sleep experimentation through data visualization of long-term trends, exploring how timely feedback can encourage behavior change in users, and reducing user burden through passive sensing of objective sleep measures and independent variables affecting sleep. Thank you.